Today I bring you a case of a nosebleed. The patient presented with a repeated nosebleed which he had had for the past week, where he had had to go to the emergency room at least 3 times. So the nose would start bleeding, but he couldn't stop it. He had to go to the emergency room, they'd plug it up, he'd go the next day to remove the plug, and in a couple of hours the bleeding would start again. He had 3 different doctors look at it. No one could find out what had happened, and he was particularly worried because he was going on vacation the next week and he didn't want to cancel it because he had plane tickets and everything bought already. So he came to the clinic, and when I started doing the diagnosis, what I saw on him was signs of heat in the yang ming, both stomach and large intestine, and some signs of overactive wound. As I usually do in my clinic, my treatment was a mix between Master Tung Acupuncture and balance method, so I used the imaging from balance method, but I also mixed in a lot of points from Master Tung. So what I decided to do in this case was a very simple treatment in which I applied in one limb, large intestine 11 and shoulder center 4406 plus dabai. Why did I choose these points? Well, large intestine 11 for once is a point which is known to release heat. It also is useful because if you do a big imaging of the face on the arm, it will go more or less around the area of the beginning of the nose, so where the bleeding was coming from. Dabai, it's on the large intestine also, and it is on an image of the face where the hand will represent the head, so it will be around the area of the nose, and also shoulder center or 4406, which is a point known to treat problems related with the nose. On the other hand, I used lung 9 and lung 10. I used the lung because it balances the large intestine channel. Also, lung 9 because it's near a blood vessel, and obviously if the patient is bleeding, there's something wrong with the blood vessels. And also lung 10 being on the hand is a good image for the face. Then I used 6605 on the foot, which is on the stomach channel. It's also a good representation of the face because the foot can also be an image for the face. And in this point, besides needling, I also used bleeding on blood vessels that were around this point. Oh, and I did the same on large intestine 11. And I also used 6608. 6608 is a point that has the indication of blood clotting, so it's obviously good to stop bleedings. On the other foot, I used 6603 and spleen 3. 6603 is a point that is on the liver channel, and as we know, the liver also balances the large intestine and is also on a good image of the face. Spleen 3 is also on the image, and also the spleen is very important to maintain the blood inside the vessels, and that's why I used it. Other than this, I just added the YNSA or Yamamoto New Scalp Acupuncture point for the nose on both sides. After needling, I left the patient with the needles for around 30 minutes, and I told him to call me in the following days to see how he was improving, if anything had changed. The patient called me after 3 days, saying that the bleeding never came back, and he actually went on his vacation, and I saw him maybe 2 months later on an unrelated complaint, and the bleeding never came back. This was a very interesting case to me because usually patients don't come to my practice for complaints like this, and it was a very good demonstration of the capabilities of acupuncture, particularly balanced method and Master Tung Acupuncture. If you like this video and you want to see more content related to this, just follow my channel. I post a lot of content related to acupuncture, particularly Master Tung and balanced method acupuncture.